Hello, all my friends in TV land. This is Senior Issues, etc., and I'm your host, Vita Verdon. Thank you for watching the show today. Now, I have an important show today with vital information for you, so hurry up, get your drink, come, sit down, get a paper and pencil, because you'll really need it. Now, this young lady that I have with me today is a coordinator from Waukegan Township, and her name is Loratta Pable. I got it right, thank God. And she is the coordinator for an organization. Well, I don't know if you could call it an organization. She's going to explain it to us, but this is the name of it. S.H.I.P. It spells SHIP. Loratta, so good to have you here today. You have information that we need vitally, and you're going to explain to us, first of all, a little bit about yourself, because I know them out there. We've become friends through the last 16 years, so they like to get a little up close and personal. So tell us a little bit about Loratta, first of all.
Thank you. Thank you so much for having me. I'm Loratta Pable. I am a Lake County native. My background is I have a master's degree in gerontology, and I've been in the field for quite a while. Been talking about Medicare since, I don't even want to admit how long, for long enough to see a lot of changes happen. And I live in Waukegan with my husband and my 3 children.
Okay, well, stop right here. We have a tradition on this show. First of all, you give 1 kiss for your husband, and then how many children do you have?
I have 3. They can share one.
And you know what? The kids, they want their name said on television so they can go, yeah! And they want to kiss. And we don't give small kisses here. We give big smooches.
Okay.
So you look right into that camera, first for your husband. Now you have to say the name of every child because they like to hear it.
John, Ben, and Anna.
And a kiss for each one. Okay, let's get down to business. Now, First of all, our audience would like to know what is SHIP? That's our main question. What is SHIP?
SHIP is the Senior Health Insurance Program. And It's a program that's been around for many, many years, and its sole purpose is
What did it come out of? Did it come out of the Department of Aging?
It came out of Medicare.
It came out of Medicare, okay.
It came out from a federal level.
Okay.
And its sole purpose is provide assistance to people who are on Medicare and Medicaid dealing with insurance issues in the state of Illinois.
I want to make it clear. SHIP is not an insurance plan, and they're not selling an insurance plan. Let's clear that up right off the bat.
Sure, sure.
Okay.
It is, in fact, to be with SHIP, you can have no affiliation with the insurance industry at all if you want to volunteer. We'll talk a little bit more about volunteering later in the show. But the Senior Health Insurance Program is a federal program that comes down through the states and is administered through the Illinois Department on Aging to local units like the one I'm with. I'm the coordinator for the unit that's with Waukegan Township Park Place.
Okay.
And its purpose is, simply not to sell, there's no profit, there's no money that changes hands. This is just part of what all of our organizations do to provide good consumer information and consumer advocacy for older adults.
Well, let's start out by giving information. I hope you have your paper and pencil. Remember I told you need it? Ready? Okay, first of all, let's give out the website.
Sure. For the Illinois Department on Aging, it is www.state.il.us/aging/SHIP.
Now that's a lot. Could you give it one more time?
Sure. It's www.state.il.us/aging/SHIP.
Okay, now that's the website. Now the second thing is the 800 number.
All right, I'm going to give you the 800 number that is for the direct SHIP line, which is 1-800-548 9034. I
Now,
know.
would that be for the state of Illinois?
Yes, that is for the state of Illinois. Now, however, if you contact the state of Illinois, let's say if you're one of our friends from across the border in Wisconsin, I'm sure they can direct you to the appropriate 800 number for your area.
For Wisconsin.
Exactly.
Okay, so later on then we'll give, or you want to give your number now for Waukegan?
Sure, if they want to
Yeah.
call Waukegan Township,
Right.
for our SHIP office, it's 847-244-9242, and simply ask to speak with a SHIP counselor.
With the SHIP counselor. Okay, let's start right at, now I know the enrollment, the open enrollment was started last Saturday. That would be October 15th to, when does it go to?
December 7th.
Okay, all right. So that means now you have the opportunity to change your insurance plan. Am I correct?
You can change your Medicare Part D supplemental drug plan.
Okay.
This is also coincides with the Medicare Part C or Medicare Advantage plan open enrollment, which is a separate thing. Most people at this point are on traditional Medicare with a supplemental plan and a Part D plan, but some people have opted for the Medicare Advantage plans, which are either PPOs or HMOs, sometimes referred to as Medicare Part C. That open enrollment is on right now as well.
Okay, so during this open enrollment, now we discussed this a little bit before the show, that you really don't have to be loyal to your insurance plan. Now, maybe you can tell our audience on some of the disasters, maybe I'm going a little extreme with it, but some of the incidents that could happen.
Sure, I'm going to talk about the Medicare Part D plan specifically.
Okay.
Oftentimes it really pays to comparison shop your Medicare Part D plan. The Part D plan is D for, you can remember it easily by D for drug. Okay, so your prescription drug plan is your Medicare Part D plan. Every year, insurers change their prices. Every year, these insurers make different decisions on what drugs are covered and what level they cover their drugs on. They have a tier method for paying for drugs. The least expensive are tier 1, and then it goes up from there to drugs that are restricted.
Are you notified on that, or this is just done?
You are, if your drug is currently covered by the plan and they're making a change, you will be notified during the year. But again, you get a lot of notifications in the mail, so it can be difficult to understand exactly what the implications are. Most people are pretty aware when they get a cost change notification, and even if you don't get a cost change notification, though, it pays to check. I worked with a couple people so far this year who their drug plan has pretty much doubled in cost, premium cost-wise. So you can find significant savings just checking and making sure it's the best fit.
So during the open enrollment, that to check on what your plan is doing and if there's any changes is an important issue at this time.
Absolutely.
Okay, so we'll go through that. Now I'd like to go into, for low-income people that are, say, on Medicare and Medicaid, some of the changes that could occur.
Sure. Well, just so people are clear, I want to talk a little bit about Medicare is the plan for people who are 65 and better.
All right.
And Medicaid is for people of very limited means who are either, it's called AABD in Illinois, it's aged, blind, or disabled. Okay.
So you could be on Medicaid, but not be of the age to be on Medicare.
Right, although people who are disabled for 2 years or more then become eligible for Medicare as well.
So they have to be disabled for 2 years
Right,
to go on to.
exactly.
Okay, I got it.
By Social Security's definition of disabled, which
Well,
that's another show.
Everything is on an individual basis.
Right.
So we have to be careful. What we're giving you is an outline plan,
Right.
but it's best to personally check.
Absolutely.
Because it's all on the individual basis. Is
Absolutely.
that correct? You don't want to
Absolutely.
be held liable for something that doesn't suit your particular case. But we want to stress with you that SHIP is available to help you through this involved process.
Exactly. In Illinois, there is a managed care initiative.
Okay.
And it's called the Medicare Medicaid managed care initiative, and people who are both on Medicare and Medicaid, who are known as dual eligibles, have a choice of managed care plans to select. There is a choice, and there is a time to do that, and of course you can switch under certain circumstances depending on what's happening in your individual situation. It's important to note, though, that you must choose, or one will be assigned to you. So it's important, if people receive notification that they're dual eligible and they have these choices and their Medicare managed care providers that work with Medicaid, that they make a selection.
So I wanted to point out, this is something that we just were talking about, that you understand this clearly. See, if you've been changed off your Medicare, you apparently received a notification, but amongst all the rest of the data you're getting from every other organization, it might have been overlooked. So it's really important to check into this, and that if they are changed and they weren't aware of it, that they do have a right to an appeal.
There's always a way to appeal.
There's always a way, but there's always a path.
And there's always a time of year where there's an open enrollment. The biggest thing really, though, is just if you have a question, it's so easy to access SHIP. You can access SHIP through the 800 number and speak with somebody right then, or you can access somebody in person. The 800 number can tell you who's closest to your area, who's most convenient if you want to work with somebody in person. And oftentimes it's going to take us more than one appointment. We're not magical. So especially if something is really complex, like if we're doing an appeal and helping somebody through an appeal process, it might take us a couple phone calls or a couple visits, but we will stick with people. It's not hard to access help.
Well, we're going to go deeper into this, but right now what we're going to go into is Vita's Pearls of Wisdom. Okay, now, the last show that I had, we talked about this of all the different variety of ways of voting. Now, this has been such a bombastic political season, and each one of us, I know, that it's not only me, I share this with all the other seniors that I know, are overwhelmed with the rhetoric and the mudslinging that goes on. Now, I want to just emphasize one thing. I am impartial when it comes to how you should vote, but what I want to stress to you, that voting is a privilege, that we should vote, and that what we should do is lay it down, the platform on what each candidate stands for, and get out there. Now, what I'm really proud of as a part of the population, the senior population, that we come out with over an 80% voting block. So it's important that you can vote, and you can call the voters registration in your area, and they'll tell you all the different ways, as I had Carla do it. But it's most important that what you can do is, the way everything is going in such a crazy fashion, we just pray about it, that God will come down in spite of ourselves and bless us in what we should do. Now, there's a few other things that I want to talk to you about. We're getting into the winter season, and in the winter season there's so many falls happen to seniors. Now, the falls that happen to season are missteps that happen, not the right fitting shoes. Maybe it's time that you use a cane. And I just want to show you the one I've taken you through all my falls, but I want to show you my cane. Look at this. I don't know if the camera can pick this up, but it's got 4 prongs, so that my cane just stands upright, and it gives me, I'm 84 years old, and I'm not ashamed that I have a cane. I'd rather have a cane than count on my reliability that I won't fall. So you have to take care of yourself. Now, I bought this at a medical supply house. All the medical supply houses have it. You have to take care of yourself. Since we're the first generation that has lived this long, we have to know how to take better care so that we can be a model for the generations that follow us. Now, as a community service, we try to bring you all the information that it is necessary, and I get calls and emails. Now, I know a lot of you have called me. you know, I'm going to confess something. I'm not that smart and just gutsy. That's how I came up with this show. But what I've learned over the last 16 years, I've learned how to be a really good researcher. So if you're stuck in some dilemma in your life, feel free to call me. It's not that I have the answer, but I have learned how to research and find all that is available for us seniors. There is so much, thank God for this country, there's so much available to us that we can take care of ourselves and use wisdom in this stage of our life. My telephone number personally is 847-573-1233. Go to the website. I've got about 40 shows online and a lot of information that you'll need. It's Senior Issues, etc., etc.org. Go to the website and see everything that we have on hand, because we have had this last 16 years because of your faithfulness, and we love you for that. We know that you have supported us, and we have grown to know you fondly. Now let's get back to the rest of the information on this open enrollment season and the things we need to know. Pay attention. She's got a lot of information. She's been doing this for years, and she's a lot smarter than me.
I don't know about that, Vita, but thank you.
Okay, now let's go into what they need to have. I think this is important. Say they're going to call on the phone. What information do they have to bring with? You did have a paper showing that, right?
Sure, absolutely. We would like people, when you call, it's always good to be prepared. It's the Boy Scout motto, be prepared. So call with your red, white, and blue Medicare card.
Okay. You know, that's that little identification card. It's red, white, and blue.
And call with your prescription drugs. You can just have the bottles right there with you and read right off of there, because the better information we have, the better information we can give you.
Okay.
And what we will do, and what people can do themselves actually, is go on to the Medicare.gov site, and there's a wonderful tool called Plan Finder, and we can enter your information right into it, and it will list out all of the plans that could cover you.
What they do, they put all this information and then it comes up with the plans that cover it?
Exactly. It comes out with a really nice customized view of what plans are available in your area. You can select if you want Medicare Part D plans, if you're interested in a Medicare Part C Advantage plan, and then you can see exactly, it'll estimate based on the best information that the companies supply to Medicare. It will estimate what your monthly and your yearly costs are, and you can sort the plans out, or we sort the plans out by lowest annual cost or lowest annual deductible, whether or not all your drugs are covered, all of those kinds of things. So we just get a wealth of information. We take your base information, we get a wealth of information, and then perhaps most importantly, help you sort through it. And
I have a question. Is it necessary to have all their doctors?
Not unless you're looking, it's really not necessary to have all your doctors unless you're considering that Medicare Advantage, Medicare Part C plans.
Okay, now explain that again so that will refresh their memory.
Medicare Advantage is really just a different way of getting Medicare. So essentially it wraps together your Medicare Part A, your Medicare Part B, and then it wraps around like a supplemental plan. I like to think
like
of
an umbrella wrap around?
I like to think of it as putting it in a gift bag. Okay, so you put all of this in a gift bag, and it's managed care, either a PPO or an HMO.
Okay.
But like a gift bag, there's some strings attached. There's that handle there. So you need to use their doctors in hospitals. That's where it's important to know your doctors.
So you would have to know it in that case.
Right.
But as they talk to somebody, that will point it out and make them aware. Now, I know since the open enrollment just started a few days ago, that you're probably really busy right now.
It is definitely busy season.
So it's best to line up your appointment or to have a counselor. Now, I know if they call in, counselors aren't always available at that moment, then will you get a call back or something? How does that telephone access work? Maybe we can talk about that a little bit.
Well, in our location, the first person you're going to speak to is going to be a receptionist, and if there's not a counselor available, they can make you an appointment to speak with a counselor right then.
Okay.
So they'll make an appointment. They've got our calendar. They can see what we're doing,
Okay.
and they'll make an appointment for you to speak with the counselor.
And now, do they have to return the call, or would the counselor call them back?
The counselor can call them back, or they can make an appointment to come in, whatever suits them best.
Okay. And now, you're just talking about the Waukegan Township that you're coordinator of.
Right.
But when we're talking about the 800 number, since this show goes into all these
Sure.
different areas, it's best for them to call the 800 number. And even if they are going into Wisconsin, that they can give them the number for that.
They'll give them the Wisconsin number.
Because
sure.
the number, the 800 number that we're giving out, give it out one more time.
It's 1-800-548-9034. They can also call if they happen to, they can also call the 800 number for the Illinois Department on Aging. That's fine too. That'll link to the SHIP line. So you kind of can't go wrong with either 800 number. And then they will they will probably give you the number to contact your SHIP site, your local SHIP site directly if it's something that they, if they're not able to help you right that moment. Or they'll call you back. I have heard of people, once it gets really busy like this, you might need to leave a number and they'll call back.
Now, what if a person is disabled and they have to go into the office?
Well, if somebody's disabled, oftentimes we can help them over the phone.
You think so?
Yeah. It's not, sometimes, depending on the person's, how they feel about things, sometimes it's nicer for them to come in because we can kind of sit down and give them printouts and have kind of a detailed discussion. Depending on what area you live, the nice thing again about where we are specifically is we have transportation available within the township. And I know other locations also have transportation. I know Warren Township has their own transportation. So there are ways to get people in if they need assistance, then that's certainly something that's available depending on the area you're in.
Well, I know this is such a good community service that you have, and that I know that you're always looking for volunteers. But now, what are the requirements like for a person to be a volunteer? I know they probably have to be trained because this is so involved.
It is. Well, before you can even sign up for training, you're background checked to make sure that you are suitable to be able to handle people's personal information, and that you have no ties to the insurance industry. Because it's very important to us that we're providing the information that's best suited to the person without an agenda.
Okay, so you see, SHIP doesn't have an agenda to sell you a policy. Or what they actually have is they have a program of volunteers that are set up, that are trained and set up to help you so that you could decide yourself what policy. But we were talking earlier, there's some infomercials on television.
Sure.
And that they actually, they sound like what you're doing, but they do have a hidden agenda, don't they? Could you go into that a little bit for our audience?
Sure. I'm a bit of an insomniac, so I'm up watching TV kind of late sometimes, later than I should be. And I'll often see, help with your Medicare, call this 800 number, or there's half-hour infomercials on policies. Nothing against those 800 numbers, nothing against those policies. That policy could be great for you, or it could not be. But those infomercials, just like anybody selling you a pot or a pan or a cleaning supply, they all have an agenda, which is to make a sale. So we really urge people to be smart consumers and to contact us and have an independent, non-biased voice. I also want to talk, going back to the point about volunteers, we do need volunteers. I've never encountered a single SHIP coordinator who says, oh yeah, we're good, we got so many volunteers, we're turning them away. We always need help. The training is pretty rigorous initially. It's a 4-day training held in different areas depending on the need for training, and then there is a test that you must pass before you get your certification. However, once you are certified, and I also want to point this out to people because I don't know if anybody's ever had the experience of calling the Medicare 800 number. It's one of those Bugs Bunny cartoons kind of where the seasons change and you're sitting on the phone waiting for someone to come. One of the great things about working with a SHIP counselor is we kind of have a hotline that we get in very quickly to Medicare. So if you have a problem with payment or you're going through an appeal process or something like that, we have kind of the Medicare hotline that we can get through right away with people. And that's one of the perks of being a volunteer too, is that you get then access to those quick answers.
I bet that you're really inundated. Is there one big thing that stands out that's happening with all people? It's the drug thing.
Right now, it's mostly the prescription drug plans. That's the hot call we're getting right now, and trying to, no one likes to pay more than they need to, and trying to manage the costs that are going up.
Another thing I'd like to bring up, say a person has their doctor prescribed a certain drug after they had their insurance plan, okay? And the drug is not covered on their current plan. Now, what happens in that case?
Most plans have a way, number one, for an appeal. There's an appeals process.
So there's the
appeals process.
Okay.
And then there's some companies also utilize what's called MTM, which is a medication treatment management, where you can try a different drug with your doctor. Your doctor has to be involved. So there's a
so then
process.
the doctor has to be involved with the insurance company to see that the drug has the available ingredients that will suit your whatever your ailment is.
Right, and your doctor essentially has to say, why this drug is most appropriate. Sometimes we have people who come in who are on an old drug that's no longer really favored, or perhaps has side effects that are of concern, but for whatever reason, because we're all different, that drug really works for that person, so they don't want to change. So there's an appeals process and a way to try and work with the company as much as possible. And then every year, there's open enrollment. So if you're unsuccessful, you can always compare next year. And we really
so
do
you
urge
can wait
people
for
to
the
do
next
that.
open enrollment.
Right.
Now, if the person doesn't get it in the enrollment period, what are the consequences of it?
The consequences are, you can, in the case you're talking about where your drug isn't covered, you have an appeals process to work through.
So you'd have to go through a great deal of
you might have to wait it out.
You have to sweat it out. All right. Now, what we had put up on the graphics, that little puzzle. Let's go through those parts.
Sure. Essentially, there are two ways to get your Medicare, and it all gets very confusing for folks.
It's very confusing, so let's take it real slow.
So we'll go through the four-piece puzzle, which is traditional Medicare.
That's what I want.
Okay, so you have Medicare Part A, which is hospitalization. Medicare Part B, which covers basically your labs and your doctor and your outpatient treatment.
Hospitalization, then your labs,
And then you have your Medicare Supplemental Plan, which, because there's much that Medicare doesn't cover in A and B, so it helps to wrap around those costs. And then there's Part D, drug insurance,
And that's the big changes right now.
Right, that's what most people are looking at comparing and making sure that they're looking at this year. And people can save significant amounts of money by comparison shopping. So loyalty doesn't pay on your Part D plan. And your Medicare supplement doesn't need to match your Medicare Part D plan.
Well, there's so much to cover. I'm glad that you can come back every year and fill us in. And one thing I'd like to ask is what kind of gratification you get that seems like such a complicated job. I'd always be on aspirin. It gives me a headache even talking about it. So what are you getting?
It is enormously satisfying to help people to kind of sort these issues out and make, it can make a dramatic improvement for people in terms of both their how they feel about their plan and in their bank account in terms of what they're saving. And to empower people to make good choices is extremely rewarding.
Well, we hope that this has helped all of you. You know what we are now. When you out there, you're the one I'm talking to, come to the end of your rope, tie a knot and hang on. You know why? Because if you take in all this information and do it right, the best is yet to come. God bless you. We love you. Catch the spirit.